The process that we have at Axon, there's initially a screening process with the physician where you are screened for, assessed for the indications for doing the treatment. It's a medical and psychiatric assessment to see if you're a good candidate to do the treatment. And then there's what we call preparation, at least 1 or a couple hours of preparing the person for their first experience, developing, trust and a therapeutic alliance with the person who will follow you through this process. And then there's the actual ketamine treatments, which we call ketamine-assisted psychotherapy. We can go into sort of the details of that, what the semantics around what we call this, but that basically just means that we're paying attention to and including quite a bit of therapeutic work in addition to just the dose of the medicine. So not ketamine treatment, but that there is this psychotherapeutic work that happens in addition to it. So the sessions are a minimum of 2 hours, sometimes about 2.5 hours, depending on how much extra psychotherapy you're doing on that day, where there's some time before the experience to talk to the psychologist or doctor who's working with you. Then there's the ketamine experience itself, which I'll get back to, and then time to talk afterwards and to do either sort of some structured psychotherapy or integration work with things that come up during the experience. And those ketamine sessions are repeated a number of times in the initial treatment process, usually 4 to 6 treatments within 2 to 4 weeks, usually. And then there's follow up depending on what that person needs in terms of integration and continued psychotherapy after that. The ketamine treatment itself lasts about an hour in total. The person is laying in a comfortable chair or in a hospital bed in the when we do it in the hospital. They've got a comfy blanket. They're listening to some calming, neutral music, and they have an eye mask to limit distraction and have a more internal experience. They get the medicine, which is done either intravenously or intramuscularly. And then after about 5 minutes, they slowly drift into a dreamlike experience that is primarily an internal process. So with ketamine, when at therapeutic doses of ketamine, you are not really present in your body. So it's more like a dream where you're in a different place, floating through the universe or somewhere else. You're awake, but you're in this internal experience. So there's not a lot of, unless it's necessary, there's not a lot of interaction during that hour. It's an internal experience. There's interaction if needed. So if somebody has anxiety or they need a little support, they can hear you and you can talk to them, support them. But if they don't need support, it's an internal process, and then you do the talking afterwards. And that differs a little bit from classic psychedelic psychotherapy, where with psilocybin and LSD, people are much more interactive during the process. And it's also a much longer process where there could be more, communication with the therapist during that time. Same thing with MDMA assisted psychotherapy. You're in a cognitive state that you're able to maintain communication throughout the process. But with ketamine, it's really internal, and the therapeutic work happens before and after. What happens in the therapeutic work with the patient before and after is dependent on what happens during the experience. So sometimes these experiences are very abstract, could be like a deep meditative process where you just feel like you're floating in space. no significant thoughts or feelings. It's just like the deepest form of meditation you could imagine. But there's no content or, you know, meaningful insight that comes out of it. When that happens, then the therapeutic work is used, sort of using the biologic mechanisms of ketamine, which we can go back to later and discuss, as a catalyst for the psychotherapy that happens. So people have increased cognitive flexibility. They have we call increased neuroplasticity. It opens what's called the critical learning period, where it's a state of where you have more flexibility to get out of stuck patterns of thinking and feeling, and develop new positive, more adaptive patterns. And so those mechanisms can be used in psychotherapy to help the person afterwards.
How long is that window open of that cognitive flexibility and that ability to sort of step outside thought patterns and thought loops after the actual administration? How big is that window?
Yeah.
Can you give some indications on that?
Yeah, it's a good question. The short answer is we don't know. There's in rodents with ketamine, it looks like the neuroplasticity, which means increased number of branches and connections between the brain cells, lasts sort of on the average 2 or 3 days, and then sort of starts tapering off. But that's the physical neuroplasticity. We don't really know in humans, so we know in rodents. That's partially why we do a series of treatments that are spaced no more than a week apart in the beginning of the treatment, so that we think that you're sort of before it's tapering off, you're getting another dose. And so we believe that that neuroplastic window, or the critical period, is sort of that whole first month of treatment. So even though the individual ones might be tapering off, you're building up. So it's kind of like giving water to a seed, and it's cracking open, its sprout is coming, and each time you're giving it another dose of water. And but it's that really that the whole process of that first, weeks to month, where you're doing the treatment process. And then I was just going to say, in terms of the therapeutic work that happens other times, if there's a lot coming up during the experience, people have profound insights or novel perspectives on their life, their, things that can be really meaningful or useful for them. Then the work that happens with the therapist afterwards is more towards what we call integration, which is taking those insights and integrating them into our lives. And the whole purpose of the sort of psychotherapeutic project is to have long-term change, in long-term positive change in your life. And what we don't want is that you have a rapid antidepressant effect, you feel better, great for a week, and then you fall back into your normal patterns, the negative patterns that you were stuck in. If you think about it, it's kind of like the psychedelic state, the mechanisms are kind of like a steroid for your brain, let's say. So suddenly you have these big, strong muscles. But then the question is, well, how long does that muscle last? And it depends on what you do with that muscle. If you just go lay down on the couch the next month, you're going to go back to where you were. But if you use those new connections, if you make use of those insights, those new perspectives, if there's behavioral change, if you get out of the house and contact your friends again, if you do something meaningful in your life, if make changes to things that, negative patterns that you're stuck in, those muscles can last the rest of your life. So that's the idea is to go from, there was a philosopher, Houston Smith, who said the idea is to go from a state to a trait. So a state of consciousness, a state of experience, to a trait of your personality, a trait of your life. How do you go from taking a jog to becoming a runner?
If you appreciated that, then click here for more content like this. Go on, click it. And don't forget to subscribe. Be well.